Good morning, Melissa. Thank you for coming in today.
Thank you.
I really appreciate it. So as you know, I'm a facial plastic surgeon, and here in our practice, we do offer a whole line of minimally invasive treatments to help with rejuvenation and kind of making the face a little more youthful, if that's what you're looking for. We offer services that include Botox or Botox equivalents, what we call neuromodulators. We offer fillers, which help with facial volume, and we even offer some anti-aging therapies that can help with texture and with the way in which the face glows and the skin looks. So with all that said, you tell me what it is exactly that you're kind of coming in for today.
Okay, well, you nailed it. So I definitely want to look more youthful. You know, growing up in television, the technology has changed, and with HD television, and there's always, when I work, there's the front camera, then there's the side camera that's aggressively close. And so you get a little insecure about it, and you see every flaw. And so I think I would like more youthful looking, and then just anything that keeps the skin fresh and healthy looking, especially with all the makeup that I have to wear every day for work. It kind of wears on my pores get bigger. So the concern is just to naturally as possible without doing anything aggressive. I mean, I've looked into threads, I've looked into, you know, all kinds of fillers. This would be my first experience. So, you know, obviously I've researched you and I'm really comfortable with your expertise and your team. So I just wanted something that's natural looking, where I can age on camera gracefully without doing anything dramatic.
Well, I love that, and that's kind of our philosophy here as well. Sometimes less is more. We probably want to start conservative. I'll give you some recommendations on what I think would work well for you, but we're not going to go overboard on your first treatment. We're going to try some things, show you what kind of results you can get, and then we can build upon that on future treatments and future visits. Where we're actually going to take some of your own blood, and we're going to use that blood and the growth factors in it to kind of help rejuvenate the skin and texture of the face, while doing a microneedling treatment where we can cause micro injury to the skin to help it regrow better collagen in the skin.
Okay, and then for the microneedling,
Yes.
What's the downtime? Because I have a work event 4 days from now.
Yeah, 4 days. Okay, so amazing question as well. The cool thing about the microneedling is it's all based on the depth of the microneedle. So the deeper you go, the longer the downtime. The more superficial you go with the needle, the smaller the needle, the less downtime you have. And so we can range that from 1 day up to a week or a week and a half, depending how aggressive we go. So what we'll do is we'll dial you into kind of the middle level microneedling, and then have you back up and ready to go to your event in 4 days from now.
And do you think this approach is better than the hard-hitting, straight to the filler?
I do. Once you do filler, the fillers can make more aggressive changes than what Botox and microneedling can do. Today, we're not addressing as much volume. So filler is great for volume. So for patients that come in that have big deficits, tear troughs under their eyes, or kind of dents in their face in places that are capturing light and causing shadows, those patients in a lot of cases need filler. When I look at your face, fortunately for you, you're nice and full, and that's the sign of youth. And so I don't want to blow you up.
Right.
I want to redefine and refine the areas that are natural for you and get them in just slightly better positions. Today, I'm looking at you and I'm not seeing anywhere where I want to put extra volume. I just want to work with what you have, kind of move it around a little bit, just to get you that subtle, natural, and more kind of rejuvenated look. With the microneedling, you can do it every couple of weeks, depending on, again, how aggressive you go. If you're going with a deeper microneedling, you'll wait longer periods before you redo that. If you do a very superficial one, you might need to redo it in a couple of weeks.
Wonderful. I'm excited. Thank you.
Well, let's get it done.
Yeah.
So the way in which we work this in my practice is I'll typically consult with you, or my nurse injector will consult with you. We'll figure out the treatment strategy for you or for whoever it might be in the practice. And then my nurse injector, who's way better at this stuff than I am, I let her come in and do the treatments for you once you guys agree on the same treatments that we've already discussed.
Okay.
All right. So let me introduce you to Neva.
Wonderful. Thank you so much.
You're very
I appreciate
welcome.
that.
So Netta, what we talked about, what Melissa's interested in is something pretty natural today. She doesn't want to be terribly aggressive. We also talked about skin texture, and she's interested in microneedling with Platelet-Rich Fibrin or PRF.
Wonderful.
Okay. So I'm going to let you take it away. I'll let you chat with her. Netta will be treating you, and I'm just nearby if you guys need me, and just let me know.
Great.
Okay.
Thank
Wonderful.
You so much.
All right.
Thank
Have
you,
fun.
doctor.
Thanks.
Absolutely.
I'm always looking for ways to have youthful, fresh skin.
Yeah.
I do a ton of, skin lasers.
Okay.
And that's been pretty much the extent of what I've done. But the key is I just want it to be natural as possible and prolong the more serious approach.
Wonderful. So we're all about natural here. Here we like to promote whatever you have. So you have a beautiful face and you actually have quite a bit of volume. So we will not be needing much filler today, if anything at all. As for the texture of your skin, we do have a PRF. What we can do is we're going to take your blood, then we spin it down in our centrifuge, which is right here. Then once the centrifuge spins your blood down, we take just that top portion because that's where the PRF was, which is platelet-rich fibrin. And in platelet-rich fibrin, not only do we have your growth hormones that are your own growth hormones, but there's also red blood cells and white blood cells, which is not in your normal PRP. So what we're going to do is cause a little trauma to your skin. And then when we add the PRF, it's just going to get absorbed in your skin. I'm going to ask you to keep it on for the rest of the day because the longer you keep it on, the more of the nutrients can get.
Does that mean like, don't wash my face?
Don't wash your face today, and if you need to tonight, go ahead, and then as of tomorrow, you can do whatever your normal routine is. I'm only going to ask for you not to use any active products, which is any retinols or vitamin A's or vitamin C's for about a week.
So basically it's like red dots?
Not necessarily. So today we're going to do kind of a milder microneedling treatment, just because you did mention that you have an event on Tuesday. So I don't want to do anything too harsh, so you can be ready for your event, but you're definitely going to be glowing. Just take care of your skin and keep it clean for today, and then you can continue a light regime tomorrow.
What can I experience as far as like throughout that process?
So what we'll do is we'll wash your face thoroughly, and then we'll put some numbing solution on it. With the numbing solution, this treatment is pretty much painless. So depending on how deep we go. But again, today we're not going too deep. We're going to do a bit more superficially, but you are definitely going to get some results in the next few days, and then you'll see more results as time goes on because of the growth factors.
Okay, thank you.
Of course.
Is that, last question, do you do it in targeted areas or all over the face?
We will do the whole face and the neck. I also like to include the neck because your face doesn't just stop here.
No.
It keeps going down. So we're definitely going to do,
too.
of course it does. And people tend to neglect their neck, and
Yeah,
I don't. So I would love to do your face and your neck.
That'd be great.
Great.
Thank you.
Awesome. Let's get
I'm
started.
excited. Great, thanks.
How does that feel?
That's fine. And the blood's in there?
Nothing yet. So what I'm doing is just activating your face. I'm just saying it, hello. I'm going to come back and go a little deeper. How does that feel?
Feels good.
Feels good. I'll take it. So again, I'm just kind of waking up the skin cells, introducing myself. Okay, I'm gonna go on your nose. It's pretty nice.
Oh, thank you.
All right, so how did that feel?
Fine.
So that was like at a 0.5. This goes all the way to a 2.5.
Okay.
2.5 is gonna make you super bloody.
Okay.
I'm not gonna make you that bloody. So what I'm gonna do now is take it up to a 1.5, see how your skin reacts, and then I'm gonna slowly introduce the PRF onto your skin, and then that's what I want you to keep on your face.
Okay.
Okay?
All right.
All right. How does that feel? You feel it more?
I do feel it. It's fine. It doesn't hurt at all. What setting are you at?
Right now I'm at a 1.5.
Okay, so I'm halfway there. I don't find any pain in this.
Perfect. Usually you do tend to bleed a little bit more on the forehead just because the skin's so much more delicate. And I'm definitely not going to go too hardcore around the eyes because I don't want to cause too much drama to that delicate skin. But this is going to help with pore size. It's going to help with the texture of your skin. This is your personal voodoo juice. All right, ready?
Oh.
So I'm just going
Oh,
to
is it
kind
an
of...
injection?
Nope.
Oh.
So it's going to feel sticky. But if you can kind of tolerate it and not wash it off.
I won't.
Just use a nice soft cleanser. Again, don't use anything too aggressive on your face, meaning an active product, an A, B, or C, just for a few days because you've got open pores.
I'll use Cetaphil.
That's perfect. Thank you. Last pass, sister.
Oh,
How's that?
fine. And those are a bunch of needles?
This is literally like a little disc, and it's going in, out, in, out, in, out. Each disc is used once only. We do not share. And I toss this after we're done.
It just feels like a roller
Yeah.
on my face.
But what we're doing is penetrating your PRF deep into your dermis. And you're gonna find, and the blood's really good for you too. All right. We just finished your micro needling with PRF. As you can see, you have a little bit of
great.
redness.
Not bad at all.
No, and that's not
Yeah.
bad at all. And that's normal. You might find that some areas are more red than the other, but just be aware of that. Remember not to wash your face, and if you want to, do it really late tonight.
Okay.
And that's about it.
Can I go in the sun or
Do not go into the sun, absolutely not. Tomorrow you can go back to your normal, just again,
Okay.
don't wear any active products. And then just wear some SPF so you can protect your skin. And then in about a week, you're gonna find that you're absolutely glowing.
It looks great. I feel like it's glowing now.
Awesome.
So it's the first time that I got PRF microneedling, and I'm really excited to see the results. I've been hearing about this treatment for a long time, and I'm just really excited that I finally did it and got it. And very little downtime, which is great for what I do for a living. So yeah, I'm excited.